His neck all the way behind, and the rope, the lead chain, or what is it? Lead rope, the lead rope,
yeah.
Okay, this stays here. Let it hang. Okay. Now the speculum. First thing I do, I check if there's incisors. Because if there would be no incisors, it would be really rude to put this metal speculum inside. I have different plates made of rubber if there are horses without incisors, because it can happen. Yeah.
Wow.
So you always have to have a quick look if there are incisors. There are.
Right. Okay.
There are incisors.
There are. So I can put the speculum inside without any fear. And then it is super important to have it nice, straight and tight. It has to be really tight. Otherwise, it's dangerous. If I open it and it's not tight enough, it can fall off. And when my hand is inside and it falls off, it's not a good idea. Okay, but this is perfect here. You can see it sits perfect.
Right. Perfect. That's good. Okay. So his tongue's down. Okay.
Yeah. Next step, it will be flushing the mouth so I can see. Because there's always some rest of food inside. Could you hold the bucket underneath his mouth, please? And I will flush. One more time from this side. Other side. A little bit more down the bucket. Okay, got it. So he was eating grass, obviously. Okay. One important thing is to protect the eyes with glasses and to have good light. And it's super important that I'm not using these headlamps you can buy. Because I need the light here where my eyes are, not up here. Because up here, it will shine too high and not inside of the mouth. So let's see. Okay. Now, could you put your hands down here?
Yeah.
Both. Yeah. Oh, yeah. And by 3, we're going to lift up the head. 1, 2, 3. And 1, 2, 3. Perfect. For the horse and for the owner, because nobody has to hold the head up.
Yeah.
And I can adjust it the way I like it to do it. Okay, let's try to have a close look. He looks quite okay for his age. I see I did his teeth recently, but he has some sharp enamel points. I will explain later how they appear. You can see them up here on the outside. Yeah, but this is not a lot. This one is far too long. The first molar, premolar, you can see. Horses also sometimes have wolf teeth, which are located over here. Around 50% of all the horses do have wolf teeth in the upper jaw, very few in the lower jaw. But they are always located here in front of the first premolar. And that is very important to take away because we are riding the horses with the bit. And the bit sits here. My fingers are the bit.
Okay.
If you imagine giving parade, what is that?
Parade.
Parade. The bit will always touch the wolf teeth, which is a small, tiny teeth with a small root, most of the time moving. And that is very, very painful for the horse.
Wow. Okay.
That's why it's so important. But he doesn't have them, or we took them away. And
Do you have one
Before.
wolf tooth on each side? Or two?
there's a variety of them. There can be 4, none, 1, 2, or 3.
Wow.
You never know.
Very
And
interesting.
why do the wolf teeth come?
It's a rudiment of the evolution.
Because of the evolution.
They don't need it anymore. But sometimes it's just I have to take away the grass here. But I think behind you is not see. Okay. Let's grind the teeth a bit now.
Okay. Oh, that's it. Yeah. Okay.
Doesn't happen, but these elderly horses are not the best. Okay, next one. I can show this hand piece is how do you say that? Full of little diamonds, because the tooth is the hardest substance of the body,
Right.
and so we need diamonds because diamonds are harder to grind the material of the tooth away.
Right. Okay.
Nothing else really can grind it away.
Wow.
Nice steel, no?
No. It's also
Right.
full of diamonds, and this is for the final touch to make the surgeons nice and round and smooth.
Wow. How can you see exactly what you're putting the instrument on, though?
Because I have a good light.
So you're seeing exact what you're putting it on, because it looks like you're just
seeing
doing that, but you are actually.
I'm seeing. But
Wow.
there's many who are doing it without looking, and that is the bad thing.
Right. Okay.
Okay, this is done behind. Let's flush the mouth, and then we can have a closer look
Great.
how the result looks like. You have the
Are all the horses as good as this one?
Pardon?
Are all the horses as well behaved as this?
If not, I give more sedation.
Wow, that's great.
Take the bucket again.
Oh, his eyes look quite relaxed.
Now we will have a look.
Want to have a close-up look now?
You.
Wanna
And
get
this is
in
the
a-
result.
Give a.
Can you
Can
see
you
here?
get close? Come over and
Can I
show
see
me.
now? I don't want to.
Yeah,
You're
no,
free
you
to
can.
be free.
No, you
Yeah.
can, but I have to give you the light. Otherwise, we have no
Okay.
chance.
Yeah. Wow. Yeah. Wow. Yeah, I can see right in there. Yeah. Wow.
This
Yeah.
is how it should look after my work is finished. What is important to know is that I have to grind away the sharp and upper points in the upper jaw outside and in the lower jaw inside,
Right.
because the upper jaw is bigger than the lower jaw. So
Right.
so the horse looks like this. So, and that's why the sharp enamel points appear on the upper jaw on the outside and on the lower jaw on the inside, because they cannot be grinded away properly. So this is what I saw. I see his incisors quite long, and they need to be shortened a little bit. That's what I wanted to do.
Right.
The canines are fine. There's maybe a little bit of what is the name of that stuff? Plaque?
Yeah.
Let's see. Well, only a little bit. Let's see. No, it's not really a lot. Nothing to worry about. This can stay, but I want to shorten the incisors a bit. Johnny, it's okay.
He's such a good boy, isn't he? Oh.
So let's see. Because it's super important to shorten or straighten the incisors, because if you don't have them, let's put it higher so you can see it in a nice horizontal line. Nearly horizontal, not yet. I can even shorten a bit here. You don't have nice functioning molars here behind, because it's one system. And if here in front we have a so-called smile or diagonal bite,
Doesn't close
it
inside.
doesn't know.
I can see that.
Wow.
Johnny, pretty good already.
Wow.
Can leave it like this. Round up the edges. Okay. Good enough for a 17-year-old pony. Good boy.
Great, eh?
Done.
Today we're meeting with Patricia, who is a... Well, what is the official name, Patricia? Is it a horse dentist or...?
I'm a veterinarian specialized in horses. I specialize myself in dentistry.
Right, okay. There's a particular favourite thing of yours. This was something of most interest to you.
Yes. I did. I worked in the university for 10 years, and I did all sorts of things, orthopedics, and I was also doing a lot of colic surgery over there. But I was always doing dentistry, dental care, and it was a passion to specialize in that. And then, of course, I took some courses to improve, and I went to all the congresses to learn more about it.
Wow, so it's great that you've got an overall knowledge as well, that it's not only the teeth that you know, so that's great, isn't it?
Not at all.
Be a benefit for you, whatever you're doing with the horses.
Yes.
So. And how long have you been in Mallorca?
6 years now.
Ah, right, okay, so originally from Germany.
I'm originally from Berlin, Germany, and this is where I worked in the university, FU Berlin, for more than 10 years.
Wow, okay.
And I decided to quit my job over there,
Wow, a brave
move
move.
to Mallorca, to make my dream come true. To be a
Wow.
horse dentist and to teach the people how important it is to do the teeth regularly.
Yeah, the good dental care,
Yes.
and the long-reaching consequences of what happens
Exactly.
if you don't do them. Wow. Okay, so I've got a few questions.
Yeah.
I can run through. Okay, so at what age should your horse be when you first consider getting their teeth checked?
You should have the horse's teeth checked the latest, the first time before you put a bit in his mouth, which is normally being 2.5,
Wow.
3, 4 years old. It depends. If you notice problems before, of course, we recommend dental care before that age.
Right, okay, so around 2 to 3 years old to get the vet, just like someone yourself, to come and just check the
Exactly.
teeth over, right, before the pit goes in.
And in actually 99% of the cases, it's not only a check, there's always things to do
Wow.
to correct. And it's very important to start early with that. Especially because of the wolf teeth I was mentioning before.
Yeah.
Because if you want to start to work a horse and put a bit in his mouth, you have to be sure the wolf teeth are taken out before.
Wow, okay,
Because
that's
otherwise
interesting
the
to know.
first thing they learn that it hurts if they have a bit in the mouth. If there are wolf
Wow.
teeth, there's only 50% of the horses have these wolf teeth, but 50% is a lot.
Yes, that is a lot. Okay. So, why do you check a horse's teeth? So obviously you just explained that now with the wolf teeth, but what problems can happen when you don't check their teeth? So as in, if you're looking at a horse, you probably
that is
identify, this horse's teeth doing.
Well,
What do
then
you-
that I have to explain a bit longer because
Yes,
our
absolutely.
horses are domesticated animals. They do not live in the countryside anymore. They are kind of how do you say that in English? Domesticated animals.
Yeah.
We feed them. They are not wild anymore. For example, a wild horse, I always think of the Mongolian pony because this is a very strong breed over there. These horses never need a dentist, and these horses never need a farrier. And now I have to ask myself why? Why do our horses need a farrier every 6 weeks and a dentist once a year? It's because we keep them different. The horses in the wilderness, they are eating around 18 hours a day. And what do they eat? They eat silicate-rich, very rough grass and green, what they can find. And for finding that, they have to walk kilometers and kilometers every day. So by eating these hard, silicate-rich food, they grind the teeth themselves.
Right, so it's done naturally.
Naturally, and they also shorten their hoofs by walking all these kilometers. They say it's about 18 hours a day a horse is eating in the wilderness. So how do we feed our horses? They are kept in small paddocks if they are lucky. If they are unlucky, they are kept in stables 4 by 3 meters, which for me is really shouldn't be like this anymore.
Me too. I totally
Because
agree.
and then the hoofs can grow without, because they don't use them. They use them 1 hour a day in a soft riding arena which we prepare for them. They will not rasp away anything of their hoofs. So the farrier has to come. And the same with the teeth. We feed them high energy grain 3 times a day if they are lucky, and they need about 10 minutes to chew it. And they don't even have to chew properly anymore because it's all processed food. It's nothing strong. There is no sand inside. In the wilderness, they always take some sand, and the sand also grinds the sharp enamel points away.
Yeah, like a natural
And the same
dentistry.
with the hay. The hay is super soft, so they don't
Yeah.
really need to
chew for long periods. Yeah.
Not only the long periods, they don't need to chew properly. They don't
Yeah.
have. They call it the power stroke. That means that they really have to chew like this to rasp away, and then the sharp enamel point gets rasped away. But if it's not necessary, of course they don't do it. So we cannot blame the horses. We have to blame us.
Yeah. I understand the reasons why they're having their teeth checks now. But if you're out, so for example, for someone that doesn't know about, when their horses need the teeth doing, they can't check themselves because, as you know, if you try to look at a horse's
don't
mouth,
do that.
it's very difficult.
Very dangerous. It's very dangerous.
Right, okay, yeah. So it's not great. So don't do that. Make sure you don't look yourself. Make sure you get a professional. So, but what was interesting is, like myself, I would know if someone's riding and their horse is tossing his head a lot. My first thing is, have you checked his teeth? Are there other things? I mean, that's just a basic one, but would you notice, it's maybe a little bit imbalanced or doing things? What would would you say?
As you said before, if you ride them and you feel them uncomfortable with the bit, if they shake the head, things like that can always be a sign that dental care is necessary.
Right.
And also if you see them eating, if they have a lot of salivation, for example, if they chew very slow,
Wow,
or if they
okay.
stop eating, that can also happen. This can all be a sign of that dental care is due.
Right, so eating very slow, lots of salivation.
Yes.
Okay, and then sometimes just leaving the food.
Exactly.
Right, okay, that's interesting points to
And
know.
in general, because some people or some horses don't show these signs, the international, how do you say that? Lehrmeinung, the
Yeah,
international-
Federation.
No, all the international dentists agree in one thing: we should do dental care at least once a year. There's
Right,
some
okay.
that recommend dental care every 6 months in a certain age. I don't know exactly now the age, but minimum once a year dental care should be done.
Right,
And if you
okay.
do it once a year, you normally do not have any signs.
Right, okay.
It's a
because you're on top of
prevention.
it. Yeah, you're not
And this is
waiting.
my passion
There's a
here. I want
problem.
to show the old horse owners, I want to teach them, want to make them aware of what we do is prevention. If you do it once a year, you can have it on your list that this is due at the same months before the competition start or whenever,
Yeah.
and then you will never have problems normally. Of course, there
Wow.
can always be fractured tooth, but the normal
Yeah.
problems do not appear.
So prevention, definitely prevention is the way forward. Yeah. Okay, so yeah, how often should I have my horse's teeth checked? So pretty much every year. So how much does it cost? I mean, obviously this is like a big question because if it has to have treatment, then that's going to affect the price. But if it's a standard checkup, what is an average? You know,
An average
approximate
yeah.
price. Don't
Okay,
put yourself
I
down.
can only
Patricia.
talk about the prices that I charge here in Mallorca.
Yeah, so
the
in a
prices
ballpark.
here in
Yeah.
Mallorca are different from the mainland and are very different from, for example, Germany and probably the Northern Europe. What I charge here is if I come to a place to do the teeth of one horse, I charge €120 with IVA included and driving included, sedation included, taking out the wolf teeth included if necessary, and the yearly grinding of the teeth.
Wow.
This is all included. If
Okay.
there is more than one horse in the same place, that means I have to drive only once and I have to set up all my tools only
Yeah.
once. I charge 100 each horse.
Wow, so it's €120 if it's just one horse, but that's including everything. So you're looking at a total
Yeah.
cost
And the
of
price
120.
goes down if the people start to collect. And this is also one of
Wow,
my
that's
passions
interesting.
to make the
In a
people
stable
aware.
yard.
Yes, it should be.
Yes.
Each yard should have their months where they do all the teeth.
Wow.
Then they collect and they call me, and then the price even goes down to €80. If it's more than 5 horses in one place, I charge €80.
Wow, so
All
more than
included.
5 horses would be €80, so it'd be good
And
to get
yeah, it's
all
a
your
win-win situation
colleagues together
because
at the
I
stables.
have more clients in one place, and the people have a lower price if they collect. And then it's this psychological point they don't forget.
Definitely.
That's
It
my
makes it-
idea.
yeah, that's such a good point.
Yeah.
Yeah, to get reminders for the stable yards.
Yeah.
It benefits everybody, the horses,
Everybody, yeah.
and it makes it cheaper for everyone. Right, okay, so that's a good thing to know. We're going to put Patricia's details in the video in lots of places, so to make sure to contact Patricia directly. Are there any horses that you can't do the teeth for, or is the sedation is you know 100% once they're sedated it's going to be okay? Because you know when you're as a horse owner myself, obviously you don't want them to be in any pain, any sign of panic for the horses. You know, it makes you very uncomfortable. So I asked that question when you were treating them, but you said that the sedation, pretty much 100%, you're fine with that. So are there exceptions or?
I always have to check the heart to see
Right.
in which health, if he has any health issues, ask the owner.
Right.
If the horse is eating well, if he has any fever or any signs of sickness, And then, of course, the sedation is more dangerous. But I can only say in 10 years of doing the teeth of I don't know how many thousand horses now, I never had any problems.
Wow.
Yeah.
Okay, so you can feel confident.
Of course, a 30-year-old horse, I sedate different than a 6-year-old.
Wow.
Yeah,
Okay.
you always have to see the age and also the character of the horse. There's quiet horses. I can always look at the weight because I can kind of guess the weight, the age, the character, and then I know which amount of sedation
Wow. Okay.
I'm using.
Right, so
It
it's not
doesn't
just a
always
case of
work,
one
but-
size fits all. It
Yes,
really
no,
is an
not at
expert's
all.
opinion. So you
Yeah.
need to make sure that whoever's doing your horse's teeth
Yes, and
does know what they're doing. It's not just a case of someone, oh, I can do your horse's teeth. You need a professional to do this. Because I think a lot of people say, oh, I'm a vet, but I also do, you know, and I think
That is a difficult thing. Every vet is allowed to do the horse's teeth.
Yeah.
Yes, but if for example, because I am a vet, a client asked me to treat the lameness of his horse, I would say no, because I'm not good in it. Of course I learned it in university, of course I did it, but I'm specialized myself into dental care. So that's
Yeah.
why I recommend always to go to a specialist.
Yeah, me personally, having seen Patricia do what she's doing, I would now ask Patricia to do my horse's teeth, whereas my vet would normally do my horse's teeth. But you realise there's far more to it than once you've spoken to a professional about it. So you want the best for your horse. I wouldn't go to a doctor to get my teeth done. You know, that's what you've got to think of.
Yeah.
So, okay, that's interesting. So once we did your pony, which is beautiful, he was 17, and then afterwards you said to make sure with the sedation that he should go into an arena because
Yeah, or you
Without
can
any
even
food.
tie the pony, the horse, but you have to make sure that he has no access to any food for at least 1 hour after finishing the treatment. That's very important
right,
because a sedated horse starts to wake up, and what a horse is doing, they eat. They like to eat, and then they start eating without being fully awake. They might not swallow correctly, and then they get an obstruction of the esophagus. And to prevent
Wow.
that, they need to be without any food 1 hour, more or less 1 hour.
and before they have their teeth done, is it okay?
Everything is okay. They can be ridden, they can eat,
Right.
everything can be normal.
And so after they've had the sedation, it's an hour you have to wait before they can be food.
Yeah.
Could you ride them after they've had their teeth
No,
done?
I
Right,
recommend
okay.
no moving, no lunging, nothing that day. The next
Right.
day, normally the horses can be ridden normal, unless I had to extract a tooth. Because then I have a wound, and for example with the wolf teeth, I recommend 3 days without bit. They can be moved the next day with a head collar or something like that, but without any bit in the mouth, because the wounds have to heal, and that it goes very quick, because the mucosa, everybody, we know if we have a wound in the mouth, it really heals quick, right?
Yeah.
And the same with horses. So in 3 days, it will be
Wow.
closed.
Okay. Well, that's interesting. About wolf teeth. And my horse had to have his wolf teeth put out when he was really young before. Could you just explain a little bit about wolf teeth? When you mentioned how many there are. And
Okay. They say that only 50% of the horses have wolf teeth. They are rudiment. What is that in English?
I think it's the same.
Yeah, rudiment of the evolution.
Yeah.
The wolf, here is a wolf, really needs these tooth, to hunt.
Right.
Yeah, but the horse doesn't need it anymore. So it really became very small with a small root, and the location it's located in front of the first premolar, and this is pretty much where the bit sits.
Right. So it's just so interesting.
And since
Yeah.
it is a rudiment, it has no use anymore. That's why it became very small. The root became very short, and that's why it's moving inside of the alveoli.
Wow.
And
Okay.
a moving teeth hit by a metal bit is really
Painful.
uncomfortable painful for the horse. They can have it in the upper jaw, sometimes also in the lower jaw. Sometimes it's unilateral, sometimes it's bilateral.
Right. And then you were saying that it's not a case that they get 4 sometimes you have to let the horses
I've-
get one, or
yeah.
sometimes they get two.
I've
or-
never seen a horse with 4, to be honest. I
Right.
see most of them have 1 or
Yeah,
2
they
in
have
the
one.
upper jaw.
Yeah.
That
Okay.
is the average.
So 1 or 2.
Yes, and it's
Okay.
very easy to extract that if you have the right instruments.
Right.
So this is why it's also included in my normal dental.
Right. So I don't think it's a big problem if your horse has got
No,
a
it's
wolf
no
teeth.
problem at
It's
all.
just a normal thing and it's
No.
included.
Of
to
course,
them
they
out.
get a local anesthesia for that, so they're not
And that's
paying.
included in the...
That's also included.
Right.
And
Okay.
then with special instrument, it's between 10 seconds and 5 minutes to take it out. Let's say it like
Wow.
this. It always
Okay.
depends.
And it's not painful for the horse.
It's not, well, it is
A little bit uncomfortable.
a little
but
bit.
not-
That's why I give a local anesthesia in that area, so they don't really feel the moment where I extract it.
Right.
And
okay.
afterwards, no, it's not really painful.
Perfect. Yeah, and the last thing is just how long does it take?
Oh,
Really? I mean,
yeah, that's
that was
interesting.
pretty quick.
Yes,
for us,
I
but-
think I'm pretty quick now because I'm doing. I mean, what I do is like how do you say that again? It's like it's all training. Of course, I'm pretty fast now.
Yes, because it's your
uh,
specialist
yes,
subject, that's what
and
you
I
do.
think it's good to be fast because the faster I work,
Definitely.
the less stress for the horse.
Absolutely.
Always say it's around 30 minutes. The
Right.
treatment itself, of course. The setup, when I arrive at the stable, until I have all my setup done, is another 15 minutes. And then we calculate 30 to 40 minutes each horse, depending on what they have.
Okay, so yeah, 30, 40 minutes. Okay, perfect. And is there any recommendations, my last question, is there any recommendations for aftercare? Do they have to have a special dinner or nothing like that?
Nothing,
They just
nothing.
Get
Just-
on with their lives.
Yes, they just get on with their life.
Right.
It's very
Brilliant.
easy. And most of them feel better immediately. Because
Wow,
these
that's so important.
sharp, maybe we have to say that, these sharp enamel points they have, this is something we didn't really talk about yet.
No,
The
let's do it.
horse's teeth, they are growing 2 to 3 millimeters every year. Yeah.
Wow, okay.
It's not correct to say that the teeth are growing. The horse's teeth are growing until the horse is 6 years old. And the molar of a 6-year-old horse is around 12 centimeter long.
Wow.
What we see in the mouth, the visible crown,
Yeah,
is maybe half a centimeter, right?
yeah.
And the rest is the root
Yeah.
inside.
But
And
that's
then
still, for 6 years, that's a lot of
it's
growth.
very long.
Yeah.
But then you can calculate. We have, let's say, 11 centimeters of root, 1 centimeter of visible crown. And every year it comes down. From 6 years on, the root comes down and
okay.
gets 3 millimeters shorter. That's why my professor told me in the end, the teeth always show the end of the horse's life. Which is not true anymore because we keep them domesticated and we can
Yeah.
feed them with slobber, mash and soaked things so they don't have
Yeah.
to chew anymore. But the life is over when the whole root came out. And what I wanted to explain is, because many people ask me, why do we have to repeat it every year? We have to repeat it because they grow, because we have 3 millimeters coming out every year. The horses eat the way
Yeah.
we feed them. They do not grind the teeth properly, and then the sharp enamel points on the outside of the upper jaw teeth and the inside of the lower jaw teeth appear 3 millimeters every year, because they are not
Wow.
rust away. And the 3 millimeter sharp enamel point sticking into the mucosa or into the tongue down
Yeah.
in the tongue up in the mucosa can cause severe injuries, severe wounds, really
Wow.
like
Ulcers.
ulcerous.
And,
That was the
yes.
English ulcerous
Yeah.
scarves. And I see a lot of horses that really have all the inside of the mucosa cut.
Oh dear.
And they
Wow.
go on
God.
eating because
It's
they,
important to get these
that
done
is
every
the
year.
most important thing actually about all these things.
Yeah, because
And
you get
the-
mouth sores
Yeah.
as well. I didn't think about that. It's not just the teeth.
No,
it's
no.
actually the interior of the
Yeah.
mouth.
Yeah,
That
that
would
is
be-
the thing
yeah.
that bothers the horse. It gives
Yeah.
pain to the horse in the end.
Wow. And then you explained to Hearts just quickly just about the jaw and how the jaw sits
Yeah.
and the importance
Yeah,
of
the
that.
lower jaw is smaller than the
very
upper
interesting.
jaw. Yeah, and
Yeah.
that's why the sharp enamel points appear in the upper jaw at the outside and then the lower jaw on the inside.
Right, that's the way it sits.
Yes.
Yeah.
The way it's
Wow.
and they ground like this, but they don't do the power stroke completely because they don't need to, because our food is so soft. They don't have to put so much
this is why
effort
it's unbalanced,
chewing.
it's grinding.
Yeah.
So it's just a
Yes.
little bit and then it becomes
Yeah.
unbalanced.
Yeah.
And so you need to make sure that everything's smooth.
Exactly.
Wow.
Smooth so they can chew better, and that the
The
do
jaw
not-
is more.
no, yeah, and that the mucosa
Yeah.
is protected.
Yeah.
You know, because these ulcers are really, really deep and painful,
Wow.
and they do not stop eating most of the time.
No. Wow.
They are so
even,
hard,
even
oh.
in the pain, they're still, yeah.
Yeah, they can. How horses can handle so much pain, it's incredible.
Oh.
They suffer still. This is what I say.
Yeah,
And
suffer
that's
in
why my
silence.
passion is to teach
To
the
make sure
people
we look.
to do it once a year.
Yeah. So is there anything else you'd like to add that we've not covered?
No,
Patricia?
that was important because that was actually the main thing for me. Yeah, why the people should do it, because it's so
Yeah.
important.
The
They
mouth
need-
ulcers as well.
Yeah,
'cause
they
I know
need
some that had
to
horse
have
had that.
a
It's
reason.
dreadful. It's like blisters
Yeah,
all the
no,
time.
there's
Yeah.
actually one thing. If the people, the owners, do the horse's teeth, or also, I'm also talking always to the owners of the big clubs. If they make sure that the teeth are done properly every year, in the end they have to feed less. They are saving food. It costs them less to feed all the horses because they can chew properly. They can really open the grains so the body can
Getting the
digest it.
benefits of the food.
Yes.
In the long run, it saves
Yeah.
on vets bills,
Yeah.
for nutrition. Yeah. Just to have it once a year just
Yeah.
makes so much
Colic,
sense.
for example, can also be a sign for a bad tooth status, for the dental care is necessary.
Yeah, because maybe they're not eating properly.
Yeah,
so
they
it affects the
stay
digestion.
smaller before it's really.
Oh, of course. So
chewed.
you can't break it down.
Yes, exactly.
Yeah. Wow, that's just so interesting. Thank you so much for your time and letting us film you today.
Sorry
We're going
for
to
my
put
English.
we're going to put all of Patricia's details at the bottom of this video. And if you've got any questions, Patricia will be, I'm sure, will be happy to answer. We've got all her details in the bottom of the video. So brilliant. Thank you.
Thank you.